Welcome back, everyone. I would now like to introduce our next speaker, Anne Pemberton. Anne's career spans 30 years of intensive care nursing. Her son's diagnosis of ASD totally changed her career trajectory as she looked to natural therapies to support him. Anne retrained in psychology, then later in nutrition and higher education teaching. She practices functional medicine and runs a busy international clinic specialising in autism spectrum disorders and chronic fatigue syndrome. Anne, thank you for being here today. I will pass over to you now.
Oh, thank you very much, Georgia, for that lovely introduction. So, hello, good afternoon. It's quite interesting sitting from this side of the fence and not being able to see you all falling asleep after your lovely lunch. And maybe that's a good thing, eh? I'm here to talk to you supposedly about nutrigenomics and long COVID, but I figured that we might all be a bit too sick in the teeth of long COVID by now. So whilst I have got that presentation for you, I have made it quite different. I'm known for jumping outside the box. So without further ado, I'll take you through what my analysis and what my approach is with this. So this is just an overview. We're going to look at the background to my approach, how I got here, what inspired this. Some of the assessment tools that I use. We're also going to look at the trauma impact because this is huge and it's not really out there yet. The only person who's really singing this from the hymn sheet is Nikki Gratrix, who now is Nikki Sky. And she did a lot of her background came from the Optimum Health Clinic. So I really want to bring that into the forefront and tell you why. Also, I'll be looking at microembolization and cytokine storm. What do they really mean to us? Because they are big words that have been thrown around that kind of describe aspects of long COVID. And then, whilst we don't have a lot of genes, there are some key ones that might give us some insight. So I'm just going to go through a few of those, and then I'm just going to tie it all together with the overall approach that I came out with some advanced practitioners that I kind of share experiences with. And hopefully you take home some nice key points today. So as Georgia said, my background was cardiothoracic ITU specialist nurse for a lot of years. I also ran the master's degree in nutrition science and practice at the Northern College of Acupuncture for 7 years. I've been head nurse and nutritionist for Dr. Damien Downing, with whom I co-authored my first book. And I've really been into nutrigenomics since about 2011. I do have an international clinic. I also provide peer support and some of my own one-day courses on things like pyroluria, autism spectrum, chronic fatigue, and things to do with the gut-brain axis, because that's obviously for the naturopath nutritionist, that's kind of our theme really. So that's me. My health background's quite interesting in itself, and particularly with regards to COVID. So I had chronic fatigue syndrome from the age of 3 or 4. I was the kid who used to sit in the road crying. We didn't have a car. We walked everywhere. My parents were quite athletic, so I was a bit of a cuckoo in the nest, really. And that again was part of my reason for coming into nutrition, functional medicine, partly my son, but partly myself. And then in 2017, I had a near-death experience, which was mold-induced pneumonia and mast cell activation. I was very lucky because I was given about between 5 and 10 days to live, actually. But what I did was I put a distress call out to Damien Downing, and with Patricia Kane, they sat up all night, put a protocol together, and then sent me some intravenous products, phosphatidylcholine, etc. the next day, and they actually saved my life. So hence me here today. I'm very grateful I am to them. 2019, just as we went into lockdown, or just before we went into lockdown, it was like my world changed yet again, because I had pneumonia. It came on within 3 hours. Obviously, I was going to be prone after the 2017 episode, and I wasn't anywhere near fully well, which I'll explain in a minute. But the 2019 episode, it was before we really knew what COVID-19 was. I just went off to see one of my homeopathic friends who also teaches bioresonance, because I find the energy medicine really good for things like viruses and stuff we can't get rid of. So I was already seeing her for something else, and I just messaged her and said, this is my situation. And she said that, we've got this virus that's going around. We don't actually know what it is. We think and she had a few theories about it, which are not really for today's discussion. It just is what it is. So I did some bioresonance with homeopathy with her, and I also followed Sarah Myhill's approach. I figured with the COVID, if I can do this fairly cheaply, fairly standard practice, then for the most part, it might be easier for the patients who are navigating it as well. So I literally took vitamin C to bowel tolerance. I gauged my dose according to how much pain I had, because the cytokine storm was a bit of a nightmare, as I'm sure all of you who've been through this now know it off by heart. So I used the vitamin C to keep the physical symptoms down. And then I used the iodine salt inhalations. And to be fair, it was about 3.5 weeks, and I was back on top again. Later in 2019, I had another episode with it, but that time it was all GI tract, and that was not a pleasant experience. As some of you'll know, I've had it there as well. And then in the November, so that was the June, in the November, I got it again. And this time it was musculoskeletal, and it presented like psoriatic arthritis. So I had swollen fingers, swollen toes, and then lots of kind of general musculoskeletal pain and burning, just typical of psoriatic arthritis. And I'm a psoriatic anyway. Not that I've ever had the arthritis side of it. So that was new. And then in March 2020, it was picked up on bioresonance, but I didn't even realise I had it, because it was just a bit of a sniffle. And after the first 3 episodes, you kind of expect it to be more than that. So I'm kind of thinking I've got natural immunity now, because I've had no brushings with it since. But it has given me a lot of tools and a lot of things to think about, which obviously I'll present to you today. I do work from a functional medicine perspective. I use the functional medicine model just as it is here, but I've found for a long time, for me, the mental, emotional and spiritual bit in the middle, although things are improving now, I felt there was quite a lot lacking there in this model, certainly in our interpretation of it. And it's almost like humans don't want to go here. They don't want to talk about emotional stuff. If somebody is delving into your mental health, we almost get this idea that we're not right in the head, and that kind of stops us from going down that pathway when it could be really important. And the spiritual aspect of it, well, that's your own journey. No one can tell you which spiritual path to go down, or even if you're ever going to go down, because not everybody is bent on that route. So I just find that whilst this gives me a nice analysis on a physical level, it doesn't do everything for me. So when I was really sick with the pneumonia the first time, the mold-induced pneumonia, I went back to Klinghart's work, And some of you will be familiar with Dietrich Klinghardt. He's a German physician who I think is one of the cleverest men on the planet. He's very quiet. He's not kind of throwing himself out there, but the stuff that he does put out there is really, I think, cutting edge stuff. So what Klinghardt is saying very clearly is we have to heal our bodies on what he calls the 5 levels of healing model. So what he's saying is we have 5 different bodies, if you can imagine that. We've got the first body, which is the physical body. We all know the physical body. It's, you know, the food and nutrition, it's the chiropractics, it's the structural stuff. And then we've got an energy body, which I guess the closest thing to that would be something representative of an aura. But those who do energy medicine, they can tell you that whether we call it an aura or not, the energy body can go out from you multiple feet. And so some people who use things like biofield tuning or shamanic drumming to work in the energy field, they might start out by, you know, vibrating their instrument 6 feet away, and then start to bring that instrument in, still vibrating, and they're waiting for changes in the person's persona or facial expression, or they're waiting for a resonance to change in the instrument. And this is because we are said to hold all our emotions in our energy body. And because we're also taught not to feel a lot of things, we're taught that emotions are good or bad, which they're not. Every emotion serves a purpose. And we're pretty disconnected from our emotions, which is why a lot of authors are coming out now, people like Bessel van der Kolk, Gabor Mate. There's about 10 authors who are doing all of this. And they're looking at how does a symptom or how does a symptom or a body part, an organ, a system tell us how we're feeling, and they're putting all that work together. I use a lovely book by Inna Siegel, which is called The Secret Language of the Body. So when I've got a person and I'm doing an analysis for them, I gauge whether they can take this kind of information in, whether it's for them, because it's not for everybody. And then if it is, what I'll do is I'll just give them a phrase out of the book that is reflective of their key area to work on. So the energy body is quite interesting, I think, and it's not tapped into very much at all. The third body that Klinghardt talks about is the mental body, and that's how we perceive ourselves in the world. And of course, that's going to come from our conditioning. It's going to come from our parents' conditioning and their parents before them. So, you know, we're carrying things generation on generation. You know, there's things in our grandparents, our great-grandparents that were really suppressed, like when the men went to war, that kind of stuff. And we've had millions of wars. You know, there wasn't such a thing as PTSD in days when we had First and Second World War, or Northern Ireland or Afghanistan, all that kind of stuff. And we're only now really beginning to see the impact of those experiences of life, and how they might impact. But the behaviour has to come out somewhere. And so we might be the subject of behaviour as a result of suppressed emotions, being triggered, shall we say. So the mental health, your mental body is all about that, what has programmed you, and that feeds into your sense of self. The intuitive body is all about, well, I know that, but why do I know it, and how do I know it? Because I've never been taught. And so you've got to heal that body as well. It's all about being intuitive with people as well, and being discerning. Quite a lot of us are not that discerning either. And then we've got the spiritual body, which, as I said, that's not for anyone else to say to you, you should be doing this, because we all have a soul's path, as it were, and we all need to go follow our intuition into whatever spiritual domain we're going to go. But Klinghardt would say it's very important to meet all these levels. And within his model, he shows you all the different modalities you could use, like shamanic work, vibrational work, talking therapies, family constellations. There's a whole raft of things, and even the science behind each level, because the science is there. It's just not sat in BMJ or on PubMed. So you've got to find it, basically. There's also what I would regard as fairly newish therapies that we could use that will do more than one level. So you haven't got a patient in front of you who you're doing some nutrition or naturopathic work with, but then you need to send them to a different therapist for all the other 5 levels or 4 levels. As I said, the spiritual path is their own. You may not necessarily have to do that, because if you do good quality energy work, you can often meet all of those needs for all 4 levels below spiritual. And then if they've got a spiritual practice, you're actually working bottom up and top down and meeting in the middle. And it is usually the energy work that's missing for most people. I'm also finding that people are much more open to this now, to the full gamut, as it were. In my timeline, as a result of what I've learned, I very much look at what are the traumas. The biggest study we've got is the Adverse Childhood Events study by the Kaiser Permanente group, who looked at 10 different adverse childhood events and how they might impact on health in the long term. The more ACEs you had, the more likelihood you would be to get cancer or something like ALS, the really debilitating diseases. And I think for me, some of the things that we almost skirt over because we don't like to go there are these things like birth and attachment trauma. And to be honest, there's a really good psychotherapist called Ross Rosenberg who talks about attachment trauma being endemic in society. And it's all about the fact that we're all busy people. We're all trying to manage so many things, especially mothers who have one heck of a workload. The mothers often lose their sense of self very early on. Give someone 2 or 3 kids and a full-time salaried job, and there's little left for self-care, in amongst all of that. And then for the children, if you've got more than one child, there can already be attachment trauma just by the fact that if you have 2 children close together and the elder child is, let's say, sick, not progressing as well as it could be, then the second one is not going to get all your attention. So it's all tiny things. Well, I say tiny things, they're huge to a child. It's looking at things like that and saying, is that occurring? Obviously, we know about the C-section situation, that's birth trauma. And if even in a scheduled C-section, there may not be that early bonding with the mother, because in an ideal world, that child's just gone through the biggest journey of its life, probably. And there needs to be a bonding situation where, it either comes out of the vaginal canal or it comes out through C-section, and it needs to go straight onto the mother's chest. But appreciating that, this mother's all gowned up for surgery, that might not happen. There might be a period where they're separated, and that will cause attachment trauma, because that baby has just been born and has literally been abandoned. And I don't mean that don't mean that in a negative way, because we would never see it like that, and it's not from the mother's perspective. It is unavoidable because of how we westernise the birth process, and don't get me wrong, some birthing places see that very differently and are adapting to it because they see the psychological side that's so important. But it's worth knowing what is there, because these kind of people, they'll turn themselves into people pleasers, which means they'll literally wear themselves out for others, and that can then lead them to a lifetime of never really being well. And this is a lot of the chronic fatigue community, a lot of them. Our sense of self from our societal programming has set the scene for us by the age of 6. We're very narcissistic up to the age of 6, and we have to be for our own survival. So it is all about me, and has to be. And then from about 6 or 7, we start to communicate more with the world. We've started to be social, etc. That then we're starting to compare ourselves with others, and that's when all the rot sets in. Basically, you know, the kids who feel separate from the others, the kids who don't function as quickly as the others, all of that will put the child into a situation where they blame themselves for everything because they can't see another avenue. If a child's with parents who are not getting on well and, you know, going through divorce or separation, before the age of 6, the child will take all that on as well, because they are purely sensory beings at that time. And I think this aspect is never really been in the forefront. And I'm not saying it should take over what we're doing kind of in the functional medicine world, but I think ignored, we've got a poorly functioning digestive system as well, because this is all going to impact. The next thing to look at is limbic kindling, which is basically Annie Hopper's work, but Nikki Gratrix wrote a lovely paper on limbic kindling for the ihcan magazine. It's 3 or 4 years ago now, I think. But it's fascinating because she was looking at limbic kindling. In this situation, the limbic system, which is obviously our emotional centre, those traumas are all sat in the emotional centre. It's the body's expression of them that are sat in the energy field. And so what happens is you can't access the limbic system through talking therapy. So over time, you can get a situation where somebody just keeps getting triggered into a meltdown, let's say, if it's a child, just by something someone says or a situation they get themselves in. And that's because when the limbic system has gone through this kindling process, it's hardwired to be hypersensitive. And that's just going to knock everything off. It's going to knock HPA axis function off. It's going to knock the hormones off. It's going to disrupt ion channel transport. It reduces grey matter in the brain. It reduces GABA, which of course is our calming neurotransmitter. It depletes neurotransmitters such as acetylcholine, so memory can go. We get a depletion of antioxidants, and then of course the oxidative stress that comes of that. And we can even get a trauma-induced pyroluria or porphyria, which is heme processing difficulties. And when we've got heme processing difficulties, we've then got CYP enzymes that are not going to work as well as they could. So there's an awful lot to this that perhaps we're not seeing in totality, really. And so, as I said, the emotions that we don't feel into, as it were, they just get trapped in the energy field. And the energy around the organ then gets a bit stagnant. And this is where things like acupuncture work. And so the organ's getting a bit stagnant, which means the blood supply is going to be slower, and therefore the nutrients are going to be slower. So that's what's happening biochemically. What's happening through the trauma side is Ross Rosenberg, as I've already mentioned, he talks about birth and attachment trauma leading to something called self-love deficit disorder, or SLDD. And these people have a really poor sense of themselves. And this comes from what he calls an energy system that is of core shame. It's magnified by pathological loneliness. So those kind of people will go from one relationship to another, can't be on their own. But then the relationships they choose are not what they need. But it's because they're lonely that they're just grabbing onto anything. It makes them very insecure. It makes them feel powerless in themselves. And then that, of course, leads to sickness. And I know this is not a nutritionist's job to delve into all of this, and we don't. It's a pattern. It's more the case that we need to acknowledge that it's there, and then we need to offer these people some kind of avenue to explore, or some kind of therapy that resonates with them at the point where they need it. So, you know, we do need to recognize it, I feel. So there's a lot of stuff on Ross Rosenberg's site. He does have a very specific focus, which sometimes can send you down a rabbit hole. His book, The Human Magnet Syndrome, kind of took the world by storm, really. It was a bestseller in no time. But I think it can just send you down a rabbit hole. So, you know, look at all of it from a different angle. And if you want another angle on it, on this particular scenario with the attachment trauma, Gabor Mate is absolutely lovely to listen to on YouTube, and a lot of his stuff's there, as is Ross's. So it is all about this self-love deficit and this idea that attachment trauma is endemic in society. We all know that the driver of inflammation is stress, the biggest driver of inflammation. Because, of course, the stress response is primordially wired into us. We are supposed to go into the stress response about 15 minutes every 2 weeks or so, and yet most of us live in it. Examples I've recently given you on the last couple of slides. So again, we have to be more mindful of the stress aspect, and I think we are becoming more mindful now. There's some nice papers here that look at the common pathways that are down when we've got a lot of stress, or the common pathways where there is a ton of information that we need to address. There's a nice paper there that looks at emotional attention and inflammation, and how by ignoring our emotions we create inflammation in the body, because we're getting symptoms of the organs that are attached to those emotions telling us, listen up, you need to do something here. And then there's lots and lots of studies on social rejection, death of a spouse, and how that affects the person. And actually, some of the studies on being on your own after, later in life after the death of the spouse, actually hastens your mortality. And most people don't live more than 4 years after they've lost a spouse. That's not everybody, but it is a high number. So again, looking at this kind of thing for the drivers of inflammation, because if we're talking SARS-CoV-2, COVID-19, we are talking a lot of inflammation. What do we know about microembolization? Because this is one of the key things that COVID has brought to us. I think it was the Royal Free Hospital, just as COVID came over to the UK, or just before it reached us, there was a huge intensive care conference where people from all over the world, anesthesiologists from all over the world, were discussing what they were seeing in front of their eyes, because as some of you will know, when we first knew about COVID, we saw it as a pneumonia, and a lot of people were put on life support and subsequently lost their lives. And the reason for that, as we found later, was because it's not technically a pneumonia as we normally see it. It is a disturbance in microcirculation as a result of this cytokine storm. And then what's happening is these microemboli are going to where we might perceive to be the weakest points of the body, but particularly the lungs. And then, although that presents as breathlessness and pneumonia type symptoms, if you actually put someone on life support because they're losing the ability to breathe, they are more likely to die, because basically the lungs get blown up, which is not a nice thing to envisage, but that's basically the easiest way to say it, really. So that's what we know about, how this thing's presenting. There's also a lot of information about the vascular manifestations of this, and they can then lead to lots of different organs under functioning. The coronary microembolization, we're now seeing sudden death, and we've seen that for a while, but I think now all the initial stuff about what is this virus, how can we treat it, etc., is dying down, as it were. We're now starting to see, well, what exactly is happening. So the coronary side of things is quite prominent, and not just in the elderly either. There are certain pockets of the population around the 30 age mark as well who are being who have a susceptibility to this. So there are lots of concerns about microembolization in specific age groups. What do we know about cytokine storm? Well, to be honest, it occurs with every kind of acute situation that brings on a lot of inflammation. It does increase mortality, and this paper here goes through that really well. It doesn't necessarily mean that you'll have symptoms if you've got a cytokine storm going on. People can be completely asymptomatic right through to full-blown pneumonia with a cytokine storm. Some people are just... Sometimes I wonder if some people are so shut down emotionally that they don't feel anything in some ways, and we do see that. And some people, because they're already not 100% well, or far from 100% well, when they start this trajectory into what we would term multi-organ failure, their organs are already really sluggish. They generally are a chronic fatigue type person, or somebody who's got one or two comorbidities, and so they may not necessarily see that they are declining in a big way. We've also got some biological markers now that can tell us what kind of a prognosis we're going to get with this virus. So Melo et al. Have reviewed various points such as interleukin-6, ferritin, leukocytes, neutrophils, lymphocytes, platelets, C-reactive protein, procalcitonin, lactate dehydrogenase, aspartate aminotransferase, creatinine, and D-dimer as really important biomarkers of the cytokine storm syndrome. And in particular, what Milo is saying is elevated levels of interleukin-6 and hyperferritinemia should be considered as red flags of systemic inflammation and of poor prognosis with COVID-19. So this paper, again, gives you a really nice summary of that. So looking at all the organs that can be affected, pneumonia is was the first thing we saw as it started to hit us on the horizon. We do find that with the pneumonia, the alveoli are choked up with white blood cells, dead lung cells, mucus and fluids. So that's meaning everything's kind of stuck in there, stagnant energy in there. Cardiovascular syndrome, we're seeing cardiac insufficiency, things like myocarditis, general toxicity from heavy metals, chemicals. We're seeing arrhythmias, they might be an early sign. We're seeing hematological manifestations such as arterial and venous thromboembolisms. We're seeing increase in fibrin degradation products, leading to things like thrombocytopenia and disseminated intravascular coagulation. At one time in my nursing days, we only ever saw that on intensive care, and certainly not to the level that we've seen this through COVID. We also see multiple lesions in toes, fingers, soles and heels, urticaria type rashes, inflammatory lesions, chickenpox-like vesicles growing, and we can see necrotic and non-necrotic purpurea, which is the kind of the reddish type rash. We've seen things like chilblain lesions and cherry angiomas more so than any other condition. You can see acute kidney damage, where you'll get hematuria, albuminuria and proteinuria. You'll get a high blood urea nitrogen and creatinine, so that's one that we could look out for, if we're seeing someone with kind of the after effects. About somewhere between 15 and 53% of cases show intensive liver damage, certainly in the long COVID people. So that's an area we can really work on. The brain, we see a lot of acute cerebrovascular disease. So we're seeing a lot of memory loss, loss of executive functioning, seizures, encephalitis, loss of balance, impaired consciousness type things, and then tons of things like dizziness, vertigo, headaches, skeletal muscle. I don't know why they put loss of smell and taste in with the brain, because you can look at that as a severe zinc deficiency as well, or zinc and B6, and you're going to lose zinc if you've got a virus, because zinc is very antiviral, and that's one of the things we often see low zinc with viruses. So yeah, it's not making 100% sense for me to put it in the brain, but that's where it is. In the gut, we see things like anorexia, nausea, diarrhea. Some people have presented with esophageal bleeding. Some people have presented with hemorrhagic colitis. And again, lots of things like ulcerative colitis, damage from the actual ulcers. Because it does present really inflammatory in the gut. I've seen a few people with this who really have struggled, and we've basically had to go back to liquid soups, and I try not to do smoothies with these people because they need something warm to warm the digestion. But yeah, soups, everything blended down, everything light to eat, just to kind of get them back on track with that. They often need a lot of phosphatidylcholine to get the mucin layer back, and the other mucilaginous foods. I've seen a few that have had kind of recurrent eye problems as well, things like conjunctivitis, increased secretions, and then dry eyes as well. And I've seen one who's had a collagen cross-linking problem that, again, we were able to kind of identify as part of this picture. So quite an array of different things to look at. So given what we know about it, I guess the big question is there any impact from the genes or expressing genes that we can identify and actually work with. The first thing we learned about this virus was it was able to bring itself into the body through the angiotensin II receptors. And it enters the lungs in that way. And when it enters, we've then got cell-free and phagocytized virus, which can then spread to other organs, infecting the ACE2 expressing cells and then causing widespread organ injury. We also know by now that the COV2 spike glycoprotein is a potential target for therapy and has been with the vaccinations. We also know that the ACE2 receptors are all in the renin-angiotensin system, which is important for homeostatic control of things like blood pressure, electrolyte balance, fluid homeostasis. So all that can go out of whack as well. And in addition to the direct viral effects and inflammatory and immune factors associated with COVID-19 pathogenesis, the downregulation of the ACE2 inhibitors and the imbalance between the renin-angiotensin system and the ACE2 angiotensin after infection might be the thing that contributes to multiple organ injury in COVID-19. The SARS-CoV-2 spike glycoprotein, which binds to the ACE2 receptor, is a potential target for developing specific drugs, antibodies, and vaccines, as we know. And so restoring the balance between these two systems, RAS and ACE2, might help attenuate organ injuries. And so the Institute of Functional Medicine have put a number of protocols together to actually help this pathway massively. The paper here is quite comprehensive on this as well. So, if you want to take this further, that's a really good starting point. Some of the things that have come up from the Institute of Functional Medicine, again, a lot of come from a lot of papers, but that review paper was pretty landmark. They've come up with things like flavonoids, coumarins, ginsenosides, and then functional foods such as fatty acids, soybeans, egg whites, spirulina. The next gene to look at is this LZTFL1. This presents itself more in the Asian community, and you probably recall at the beginning we had quite a lot of kind of Indian, excessive numbers of Indian deaths, and this was the gene that most of that was put down to. It does present itself in 60% of the Asian ancestry, and Davies and Hughes at Oxford University did a lot of work on this, and they found that the increased risk in this population was not because of a difference in gene coding for a protein. It was more because of a difference in the DNA that makes a switch to turn a gene on. And so from that perspective, it's much harder to detect the gene which is affected by this kind of indirect switch effect. Hence why it took quite a while to kind of isolate this one. What they have said is that this mostly affects the lungs rather than the immune system. And that this gene, as a result of their research on COVID, they found that this gene might also function as a tumour suppressor. The next one to look at is this IFNAR2. And the protein encoded by this gene is a type 1 membrane protein that forms one of the two chains of the receptor for interferons alpha and beta. The binding of the receptor stimulates the Janus protein kinases, which in turn phosphorylate several proteins, including STAT1 and STAT2. Now, the STAT1 protein is really important in keeping the balance of the immune system by controlling interleukin-17 pathways. When the STAT1 protein is turned on or activated, it blocks or inhibits this pathway completely. So the mutations in this particular IFNAR2 gene are associated more with immunodeficiency. And again, there's a reference there to follow it up. This is Peter D'Adamo's work. He runs an interpretation database which is called Opus 23. It's quite a nice community, actually. He puts a lot of research in that database. I have to say it's one of my first ports of call when I'm looking for something particular, because he does some really nice diagrammatic stuff that you can just tap into. You load your report, you load your 23andMe data or whatever data you're using in there, and then it does all the analysis for you. So here, what he's looking at is the use of curcumin to help the expression or not of IFNAR2. And if you look out from the middle, it tells you which genes the curcumin will work on. Because whilst we might have isolated a few genes here to look at today, there's a massive impact, because you can't just isolate one or two genes and say, this is an issue, because every gene impacts on every other gene in the pathway or enzyme, because the genes instruct the enzyme, of course. So looking at curcumin, it could help NF-kappa B1, which we know is massively inflammatory. It can help MAOA and mTOR, COX-2, another inflammatory one, MAOB. So that's helping neurological inflammation as well. So there's quite a lot of impact just on curcumin itself. And I kind of like how D'Adamo puts this together, because he makes it fairly easy to be able to discern. The other gene that might lead us to is the ABO gene. And this is the gene that determines our antibody blood type. It has several other effects in the body other than transfusion, because we do ABO typing in hospitals. If someone needs a blood transfusion, that's its kind of role in NHS work, as it were. But we also know some of its other effects include regulating important immunological aspects of the digestive tract. And there's several illnesses that have shown a variation between different ABO blood types, including things like blood viscosity, risk of cardiovascular disease, particularly for type A's, and certain chemical reactions to stress. Now, we all are meant to secrete our ABO blood type antibodies into our mucin layers, and the mucin layers are in the GI tract, the urinary tract, the reproductive tract, and the respiratory tract. And so if we are what he would term a non-secretor, and we're not secreting our ABO blood type antibodies, then we're going to be more susceptible when we get a virus like this that comes and hits us. Some of the approaches we can use are not necessarily all nutrition related, interestingly. Things like Qigong, which is an ancient practice, exercises to stimulate, to regulate the energy field. Tai Chi is very similar. You could follow the blood type O diet. We get mixed reviews on this now, because it is very old research, and we are what my mum would term Heinz 57 variety now. We're not all of the place where we were born, and we're not staying where we were born, eating the foods just from that area. Foods come from all over the world. So, this type of idea came from time when humans didn't move around very much. So, depending on your heritage, might determine whether you have a good result with it or not. But the idea is that you would use secrete diet type modifications to try and help the situation with COVID-19 should you have a long version of it. The ABO antibodies also can link to FUT2 because of the fact that we're secreting ABO antibodies into mucin layers in normal circumstances. And when we go to FUT2, this particular gene is responsible for us making enough bifidobacteria, keeping it stable in the large intestine. And then, of course, if you haven't got enough bifidobacteria, then you might not even absorb your B12 or your folate, because if you've got dysbiosis, the dysbiosis are going to get all that. So that then will lead on to other things, which we'll come on to in a minute. So this slide is telling us, you know, for the FUT2, we need to do a non-secretor dietary modification. We need to give probiotics, in particular bifidobacteria, to try and stimulate that. And oligoribonucleotides would help with healing up the gut as well, getting the tight junctions to come back together. So some papers here just to give you a feel of what you can use to help with FUT2. So bifidobacteria is a big one. A couple of papers there from 2015 and 14. And then quite a few papers on B12 and folate. Because, of course, if you haven't got enough B12 and folate being absorbed due to an underlying gut problem, then you might have problems with methylation as well. If you've got low B12 and folate, you might have a high homocysteine. Also, if you've got a low B6, you might have a high homocysteine as well. And so then that brings us right into methylation and the key genes that we know in there, like MTHFR, MTRR, MTR, TCN2, carrying your B12 into your mitochondria, MAT1 and 2, DMGDH, which are enzymes that take methionine up into the methyltransferase cycle to create phosphatidylcholine, etc. So all of this just gradually gets impacted, and the more toxicity, the more cytokine storm we've got going on, the more likely this is to happen, and then all the genes are switched on to express. So the body's just fighting its own cause at that point in time. The other thing that seems to be quite important is this interleukin 13. And this one is a class of immune hormones known as cytokines. Interleukin 13 downregulates the activity of white blood cells, particularly the macrophages, and then as a result inhibits the production of pro-inflammatory cytokines and chemokines. This interleukin 13 has been found to be critical in the pathogenesis of allergen-induced asthma, but operates through mechanisms independent of IgE and eosinophils. And in some studies, dietary lectins have been shown to produce these immunological reactions due to their ability to stimulate interleukin 13. And so, you know, some of the time I kind of look at mine and say, do they need to be lectin free for now? You can tell those people, because, you know, they can't do the grains, they can't do the pulses, etc. Struggling with a lot of foods, because lectins are just about in everything. So yeah, looking at those as well. And the lectins are very inflammatory, so they will cause even more gene expression. So there is a bigger picture that Baranova looked at, and this is a new study from last year. They looked at a total of 20 genome-wide studies. They looked at a total of 20 genome-wide genes which were detected for the COVID-19 under in genome-wide association studies. And those particular genes included all these on this list. A lot of these, they're genes that we've not really come across. They're not in any of the gene testing companies. And so there's not an awful lot of research, but then bearing in mind, we've only really been doing this research for the last 2 years. It's probably going to take another 15 before we get anything discernible out of this. So I think, we're on a starting point, but, maybe by the time we have enough information, we'll be well over this pandemic stage and it'll be part of our commensal bacteria anyway. And then you can take the picture even bigger, given how I started this initial conversation, where we looked at, the impact of trauma. And then you can go to people like Bruce Lipton, who did all the early gene studies and the cell membrane studies in the 60s, bless him. And he is out there saying we can change gene expression by the thoughts in our own head. And there is a lot of preliminary studies coming through now that say exactly this. I mean, Lipton would say it's a very complex situation. People have been programmed to believe that they're victims and they have no control. And we see this in allopathic medicine a lot. We're programmed from the start with our mother and father's beliefs. So, for instance, when we got sick, if we were told by our parents that we had to go to the doctor because the doctor is the authority concerning our health, we all got the message throughout childhood that the doctors were the authority on health and we are the victims of bodily forces beyond our ability to control. But as Lipton quite rightly says, the joke, however, is that people often get better on the way to the doctor because they're already set in their belief system that this man is going to heal me or this woman is going to heal me. And that is because at that point in time, innate healing sets in. And this is another example of the placebo effect, placebo-nocebo effect. So I think this whole thing is really, fascinating. My general observations on that, I'm neither pro nor anti-vaccines, so I'm not here to open a debate on that at all. I have been a sole midwife to thousands of people over 27 years of nursing. I've also had the experience of elderly care nursing homes where, some of my family have ended their days, but also I've worked there as well as kind of, for extra pennies. And what I do know is, whatever vaccine is going around at the end of the year, the flu vaccine, etc., anything that these poor souls need, in our attempt to keep, to keep anything like this spreading throughout the home and killing them all, we have to consider that the people who've been affected by all of this, most of them, they're tired, they're frail, their immune systems are all down, their lights are going out. They've been through really tough lives. We can all sit here and say we've had a tough life, but, we haven't gone through world wars. Their family may be far removed from them. So, anything that promotes a cytokine storm where someone is going to feel body-wide pain and they're living this kind of life, is that not just the thing to help their mindset shift to transition off the planet? And it's interesting because when you have been a sole midwife to thousands of people and you've seen that stage of people's evolution, you kind of see things in a very different way because we do all fear death like there's no tomorrow. So yeah, they're my general observations, and they make this whole idea around trauma sit well for me. If we go into Chinese medicine, and I chose Chinese medicine particularly because they're the ones who really do relate our emotional feelings to our organs. And in particular, they look at the lungs as the organs of grief. And they say when we have things wrong with our lungs, we have a deep fear of choking or dying. But also that we're afraid of facing life, which makes sense. You're kind of in limbo, really. The phrases that come out are things like, I smother my tears, sadness weakens my lungs. And yet we're looking at a situation where we've got pulmonary embolism as well. And with that, they relate these emotions, a shattering of joy, an accumulation of sadness, a helplessness, and a case of I no longer feel at home in my body. And, you know, when you look at that, you know, what I said about earlier about people who lose their spouses, these are all the emotions that are going to be prominent. The other area where we focus in situations like this is on the heart, because of course we've had a lot of deaths of people just, you know, collapsing and leaving us. And the heart is very much about the emotion of love. Chinese would say when there are things wrong with the heart, there's a deep fear of losing or not having love. There's a deep loss of control. There's a divided feeling over the meaning of life. Why am I here? What am I supposed to be doing here, etc. There's also an element of people being emotionally unstable. There's also this idea that we live in this frenetic pace of societal life where we're absorbing all kinds of things from the media, from external sources, instead of listening to our own heartbeats. And a lot of us just live in our heads. We're just continually in analysis paralysis. And there's a lot of work being done now saying, you know, we actually need to come back to the heart and work from the heart, because when we work from the head, we can tell the head whatever it wants to know, and we'll just go around in crazy soup. So, you know, the heart's really important, and there's been tons of research from the Heart Math Institute on the energy of the heart, etc. Chinese medicine also look at the heart being deep grief, more to do with the father than the mother. And this deep grief can bring on bradycardia and faints. And of course it will, if you think about what I said about the energy being stuck around the heart. You know, you don't have to think about when something gets you, you put your hands straight there, don't you? You know, but if you've got low energy around the heart, if the heart's closed, as we might call it in energy medicine, you're going to be prone to bradycardia and faints, because while this heart is all locked in, the blood supply is not going to get there, your electrolytes are not going to get there, things are not going to function as well as they could, the oxygen's not going to, there's not going to be enough pump into the lungs to get oxygenated. And then that's going to lead to things like anguish, or just general decline, basically. But with the anguish, we tend to get tachycardia instead, which is the faster pace. So this is how the Chinese are looking at this. I think it's important to look at how we compare, how we see the heart. So in a functional way, which is where we're looking at this from a biochemistry perspective, the heart is a pump with 4 chambers. It pumps blood to the lungs for oxygenation, and then it pumps oxygenated blood around the body. It beats 100,000 times daily and 35 million times yearly, 2.5 billion times in a lifetime, probably. So that's kind of the functionality of it. But I've been talking a lot about emotions during this session, and emotions are energy in motion. One of the best books on this topic is Bessel van der Kolk's The Body Keeps the Score. So if you haven't read that, I would urge you to read it to get a bigger concept of what's happening. We look at it as stuck emotional blocks, which is blocking the energy, which means the blood supply is sluggish, the electrolytes and the nutrients are slow to reach the organ. Then we start to get cell danger response, and then we start to get organ decline. Nutrienergetic systems, or the NEST system, actually can look at this really well as well. They have a scanning system that scans the body for the energetic hurdles to jump over. And they use infraceuticals or pulsed electromagnetic frequency to shift those energy blockages. But also when you scan yourself, you go into your scan yourself, because it's all available to the patient as well as the practitioner. And you look into the organ where there's a likely blockage, as it were, energy blockage, and it tells you what emotions are behind that, and therefore what you can do about it. So there's two different ways of looking at a particular organ there, and I've chosen the heart just because it's one of my favourite organs anyway. So from that, I learned very quickly that addressing the biochemistry is simply not enough. And so we need to address all 5 levels of healing to really get a person back to wellness. And if we don't do this, what happens is they keep coming to us for leaky gut, dysbiosis, Helicobacter, gut-brain link stuff, and we keep doing the same thing. We might do a 3 to 6 month program, and then a year, 2 years later, they've hit another stress bucket. Their stress buckets become overloaded. The digestion's petered out again because of the stress, and then they're back to us with the same underlying problem again. We never really get to it. So I think, for me, this is a key area to look at. So based on what I've learned from all of that, this would be my way of approaching any chronic, unremitting illness. My phase 1 is all about stabilising the gut-brain axis. And to do that, it might be a 2 or 3 month programme with things like supporting HPA axis, supporting hormones, so you've got all the communication in the body going, supporting the neurotransmitters, so there might be things like theanine to balance GABA, there might be some tyrosine if a person's got real brain tiredness and then body tiredness as well, or the person who's got a narcolepsy type profile. We'd also support the digestion, so it would be an analysis of, do they need hydrochloric acid, do they need digestive enzymes, and which particular ones, and if they've got a sulfation problem, then I'd go for Houston no phenol, so that we can actually get a high polyphenol diet in to increase microbiome diversity, because the enzymes would help us do that. Also look at bile salts, do they need bile stimulation? And if not bile salts, do they need something like taurine with beetroot complex to just get the bile flowing again? But I'd also warn them at this point in time that if we need to move the bile because it's stagnant, because the gallbladder and the liver are the organs of anger, anger, resentment, that kind of stuff, really low vibrational frequencies. What happens is, as you start to stimulate bile flow, you're going to get not only the toxins that have been stuck up beyond that gallbladder that haven't been able to filter out of the liver into the stool, you're going to get the emotions that come with it as well. So I often just sit with mine for 5 minutes and just say, you may get a bit of an explosion of your emotions. It might be anger, it might be tears, but you've got to let it go, because we're very good at harboring stuff in here. And then just teach them to somatically connect to it, because if you do feel into them, they go very quickly. Or I might send them off to a somatic therapist who can help them titrate their own breathing, and just help them to self-partner in a way. So it's things like that that we do in the first phase. I'd also consider, do they need essential fats, fatty acids for the inflammation, and do they need mixed bicarbonates, both for the digestion, because we need potassium to boost the digestive process, but also we need the bicarbonates for the cell membranes. So it's a case of stabilizing the whole body from the easiest route and from the core route. Phase 2, I would let them go through all that stabilisation period. Then in phase 2, they would come back. We'd then look at antimicrobials for whatever we see growing in the gut, whatever we've tested. We'd be looking at polyphenol, high polyphenol olive oil, because, Miguel did some amazing research a couple of years ago looking at microbiome diversity and saying that we needed a high polyphenol diet. And we have so many people out there who can't do high polyphenols because the digestion won't take it because they've got sulfation issues. So this is one way around it. Get the digestive enzymes in to help that system and get high polyphenol olive oil and herbs and spices to get us those polyphenols in, because particularly in the UK, it's really hard to get 30 to 50 different vegetables on your plate through the course of a week. And yet you need to do that to get microbiome diversity, which is why the Mediterranean diet is so good for us all. So these are kind of the things to think about. So once we've cleared up the gut and we're starting to see some progress here, that might be another 2 or 3 months. We then go into phase 3, which is to eliminate any heavy metals that might be there or any chemicals. So we might test for that at this stage as well. And if we've got those to clean, I generally use things like the Epsom salts baths they might already be on if they've got a sulfation issue. I'd use the AMD ion cleanse, which we can get in the UK. I use binders, and there'll be a variety of binders from Toxaprevent to mixed charcoal binders. They're all kind of different depending on the profile of the person. I'm careful with B vitamins. I generally don't put them in until this stage unless I absolutely have to. And the reason I don't do that is because as soon as you start to put B vitamins in, they're going to release heavy metals anyway. And if they're already coping with antimicrobials and rebalancing the gut-brain axis, they're not going to appreciate a load of heavy metals being dumped in the brain as well. So I tend to leave this until a bit later, till the body can cope with it better. And then phase 4, I look at viruses. Do they need antivirals? Is this going to be a nice short sweep because they've only got something like, maybe some Epstein-Barr sitting around, or herpes simplex, herpes zoster, maybe a bit more of the dreaded C1 that we're talking about. And if they've got a lot of viruses, or I suspect a lot of viruses, then I might even send them for bioresonance because we get a quicker response sometimes with that. And they're not as ill with it either, because the bioresonance will kill all the viruses, clear all the EMFs out of the body, and then it'll rebalance. So they actually come out feeling better. But it depends on a lot of things: cost, ability to travel to these places, etc. And of course the intuition of the practitioner who's delivering the service. From a nutrition perspective, my dietary management fluctuates quite a bit. If I've got someone who is really struggling with the inflammation and we need to do an awful lot to try and help arrest that, I might put them on AIP or paleo for a short period of time, but I tend not to leave people on these stricter diets. I think get them back into homeostasis, get them to a place where they actually feel better, and then start to get all the polyphenols in if you can, because you can't get all these polyphenols in with an AIP diet. Some of them, they're actually better vegan, and that's because they're not digesting and absorbing very well. And as soon as you start to put heavy proteins in, they start to really struggle with tiredness, fatigue, and that's often not helpful. And even if sometimes we give them quite a bit of betaine, because they're artificially supporting that, sometimes the mindset's not quite there. And so what they'll do is they'll get themselves into a pickle because they're taking the betaine, And then they start overeating because it's easy, but then they don't realise that there's still a functional problem there. And we just, we're guiding them through that area of functional problems so that we can get the digestion to reset itself. So a lot of this is more coaching than anything. If they've got SIBO, I often use the elemental diet for a couple of weeks. It's expensive, but it means I don't have to use an awful lot of antimicrobials either, because the elemental diet will see the SIBO off on its own, which is great, really. Yeast and parasites, again, whole food with precise blood sugar balance, and looking at the parasites and saying, are there any particular foods that these parasites particularly feed on, and then just starve them out as well. And then whatever antimicrobials, antiparasitics we need. Sometimes we use intermittent fasting because, again, juice fasting, particularly with fermented juices, and Patricia Kane's got some beautiful ones, you can clear a gut out of all this stuff with that, with a fermented juice, fermented vegetable juice. The difficulty with it is if someone's got a severe blood sugar issue, then it's not safe to do that with them. So it is all about, managing expectations, looking at what can I actively do for this person, how safe is it. Always look at lifestyle with these people as well. I find most of them have got some element of vagal nerve stagnancy, and so stimulating the vagal nerve is a must, just to get the digestion back on track, get them down out of the cloud that they're in with the stress. And sometimes this is the easiest way to do it, rather than trying to depend on your B6 and zinc, your adrenal support, etc. Sometimes that's just not enough, because we've got to wait. We've got to give the body time to assimilate all that. And, if we're in so much stress that it's not assimilating anyway, this is often the best thing to do. So things like the Modius, which was originally designed for weight loss, it's vagal nerve stimulation through the vestibular system. We've got Apollo Neuro, and then if you don't actually want something that you plug into your ear to cause vagal nerve stimulation, the Sensate is really good as well, which is a nice little vibrating pebble with binaural beats going in your ears. And the binaural beats, medical music, there's tons and tons of research on this stuff, saying that we're all vibrational beings, and the sooner we get back to our practices of being vibrational beings, the sooner we'll all heal. I often send people to Nikki Gratrick's, or Nikki Sky now, Healing Circle. She does a monthly healing circle with her own meditations, guided meditations, or you can buy the guided meditations for pennies on her website, or you can get them free on YouTube. If you just put Nikki Sky YouTube meditations, there's 4 of them on there. And I often send my patients to those because they're visualizations about watching the body heal, taking the body through a healing process. And another one that I find my patients absolutely love is one called Self-Love, which goes back to that idea that we've attachment trauma brings self-love deficit. So I often send my patients to those. It's really important to get the circadian rhythm back in sync. So all the things we can do for circadian rhythm, getting up in the morning and going out in the sunlight. Hopefully you get a bit of it this time of year in the UK. It's a hard one. But, getting off the computer, getting off the white light, in the evening, and not working late into the evening, and, doing practices to just get your circadian rhythm back in track. The other thing I use quite a lot to help the detox more than anything, and to help the hydration of the cells, I use Wayback Water, which is the other name for that is EZ water or structured water. And again, lots and lots of research on the fact that this holds our hydration much better, and our cells should be EZ water. but often they're not, which is why a lot of people end up really dehydrated. And when you tell them to increase their water intake for that reason, they just say they pee it out every 2 minutes. And so they won't do it. You don't get compliance from day one. But that's generally because either their electrolytes are not balanced because the cell membrane's letting it all go, or it's because the water's wrong. So the way back water can be a great way forward for that. The other thing I often use is an aqua vortex, which is again available in the UK from I think it's Panacea Health. But you can just type aqua vortex UK, and literally it looks like nothing. It's a little spring that goes into a funnel, and then what you do is you put your filtered water through the funnel and it creates live water. So bearing in mind the water that we drink every day is stagnant in pipes, so it's not going round it's not going down around a riverbed over stones, etc. It's not coming down a mountainside. It's done that months before, and so there is no aliveness to the water. It's literally dead, and the aqua vortex puts the aliveness back in. So I find with that combination, we get a lot better hydration, which also gives us a lot more energy, but it helps the detox a lot better. I often send people to do emotional detox from phase 2. So whatever I've identified in the history that needs emotional detox, I'll either send them to explore biofield tuning, or I'll send them off to explore drumming circles, because all of that just vibrates the energy field, as I said. If there's specific things like attachment or birth trauma that they want to work through, rather than just transmuting it with vibration, which can, for some people, can be the absolute best thing, but for others, they need to kind of work through it in a process. Shamanic work can be amazing. So I have a few really good shamanic practitioners in my area who I refer out to. The solfeggio frequencies, I've got tons of research behind them as well. Again, you can just Google those. You can find the 9 more pertinent frequencies, and in particular, the 582 hertz frequency is the love frequency. So I often, particularly with the ill and the kids, I'll often say put solfeggio frequencies, whichever one is calling to you at this point in time, put that on and just listen to it for 9 hours overnight, or however many hours you sleep. And you can get those free on YouTube as well. Power Thoughts Meditation Club is probably the best source. But again, you know, they can be amazing. Music and movement, one of the best things we can do. You know, when we were tribal, that's what we did in an evening after a stressful day. There's a YouTube channel. The YouTube channel there is Nikki Skies, with those 4 meditations that I talked to you about. The 2 on health, abundant health, and self-love, I think, are the best, some of the best ones I've done. They're only 15 minutes long. Most of my clients, they come back to me and tell me how powerful they are. And if you wanted to go even further than that, and Nikki has her own ascension school, which really is the kind of the top end of the 5 levels of healing. Not for everybody, of course, but you know, it is for those who are at that level. So based on all of my learning, what I've done and what I've learned with Nikki is I'm now classing myself as a medical intuitive, because I can analyze things from this timeline that includes all traumas, family dynamics, behaviors associated with the diagnosis or the conditioning, and I can report all that back, demonstrating the impact of traumas on health, and then offer the potential therapist to address that alongside whatever naturopathic or nutritional plan they need. So from the summer, I'm going to be talking about autism on my own course network, with a view to building a team to do this in-depth analysis, and for me to do the analysis and then to pass these patients on to practitioners who want to go through this program. You know, if it resonates, you know, so if anybody's interested, feel free to email me. I'm looking at how that's going to manifest right now. The Nutrigenomics book is nearly on the shelves. That's my gift to the profession. release date's the 21st of the 7th, which I've written that in a way that takes us right through how nutrigenomics came to us. I've gone through every pathway, and at the end of each pathway, I've put a case study in to demonstrate how we've worked it. So I'm hoping that that will give everyone the edge on the nutrigenomics, because I think it's all in one book now. So hopefully that's going to be really helpful. So that's the end of my presentation. So I want to say thank you very much for being here. And if I just take my slides down, I'll try and find my way to the chat box. So if anybody's got any questions and they're in the chat box. How do I do this? Help.
Hi,
do I just press leave to come out of this?
no, if you just next to that where it says event and there's like a red dot next to it.
Oh, yes, sorry, yeah.
If you go on there.
Yeah. Oh, right, okay.
And then, oh no, sorry. If you go to stage, so go along to.
Fantastic.
And then there should be a Q&A, that Q&A box.
Brilliant.
Next to the word chat, the questions should all be in there.
Got it, Georgia. Thanks very much. Okay. So
where you're in chat at the moment, if you go to the left, where it's highlighted chat in blue, next to that where it says Q&A. Oh, there we go.
Yeah. Okay. Fabulous. Right. Let's hope we can get through these then. So, Jamie, in relation to betaine hydrochloride, yes, absolutely. I use Designs for Health or Biotics Research or something, of a good quality one. Iriona didn't understand why B vitamins are introduced later. It was because the B vitamins open up the methylation pathways, which means that the body is going to start turfing out heavy metals that are in storage. And when you're already coping with changing the microbiome and trying to stabilize the body from a communication perspective, it's hard work for the body to have to move the heavy metals as well. So generally speaking, they end up dumped in the brain and the person's got brain fog on top of everything else. So I don't like to do that. I like to practice safely. Georgia, the group who scan the organ systems, that's Nutri-Energetic Systems, or NES. They're based in, where are they based? Poole, I think. So yeah, there's some really interesting stuff there. What else? Any experience with clients that developed MCAS following spike protein exposure? Not specifically, Kirsten, but my own experience with that was MCAS, following the mold-induced pneumonia, basically because it shuts all the mold shuts all the breakdown enzymes for the histamine. I don't think we'd be talking anything different, because MCAS is MCAS at the end of the day. So you've got to go in and mop all the histamine up and get the body working in the best way you can. So I don't think it would be that different to what I did for mine in the early days. Which energy form of therapy would be good as an adjunction? Some of the herbs are recognised as spiritual healing herbs. Oh, they are as well, aren't they? And I'm not a herbalist, but I do love herbs and essential oils and all of that kind of stuff as well. I think the forms of energy therapy, if you're just going in at base level, and this is something that you want to offer to your clients, so you can just send them away to do stuff, I would send them to the vibrational healing things like solfeggio tunes or binaural beats for focus or for sleep or that kind of thing. But I particularly love the solfeggio, and I particularly like the 582 hertz, because that's the one that heals DNA. So my starting point would be that. and it would be Nikki's meditations, which are based around that as well. She's got the solfeggio frequencies, all of them embedded into her meditations, and they're free, as I said, on YouTube, or if you want to buy them so you can download them onto an MP3 player, then they cost pennies. They're about $13, I think, so nothing is really expensive. The other energy forms of healing, there's a lot of stuff really surging up now, things like gong baths, sound healing suites run by, you know, kind of shamanic people, or drummers even, and I would send people to that, experience that as well, because what you're doing with vibrational healing is you're vibrating the energy field from the outside, and as you vibrate the energy field, you're bringing the traumas out. You're bringing the stuck energy out, which is bringing the trauma out, but you're not having them go through a re-traumatizing experience, if that makes sense. Because as the energy moves, they're able to just let that go. I mean, obviously, you might get an emotional display out of it, but I always throw a box of tissues and say, you know, crying's not a medical emergency, it's fine. You know, so if you're doing you can do small groups yourself, I guess, on things like that, or they can do it themselves. But this is the idea of this, is to send them to something quite simple so they can do it themselves. So yeah, and the only other one we've got is, can you type out the name of the intravenous injection? All right, okay. Let me do that then. You better hope I can spell this. I can't do it. Won't let me reply. It's phosphatidylcholine, or PC, and it's Body Bio. Is the company. There are lots of companies out there, but it's just that Patricia and Damien work together, and I was their head nurse and head nutritionist for a long time, so it made sense to ask them for their help. Preferred enzymes for post-sulfation polyphenol issue. They're Houston, Houston, and the product itself is called No Phenol, spelt with an F. And the only place I've managed to buy those from is a lovely lady who runs a company called Mandimart, MANDIMART. And she's a mum of an autistic kid who basically is buying all these lovely products in from the US at cut price. So she's not giving a big discount to practitioners, but I think I like to support her because she's doing a lot for the collective, really. What else? I think that's it. The Aquavortex, if you just Google Aquavortex, just as you've typed it out, Orly, and UK, it begins with a P. Is it Panacea Health? I'm not sure. It's something like that. Can I do it? I'm not sharing my screen, so let me just Vortex Water Energizer. It's called Panosun, PANOSUN.org. So you can buy it from there, and I think that's it. Yeah, I think that's it. Yeah.
Hi, Anne. Thank you so much for that. That was great. And thank you for taking all of that time to answer all of those questions. We are going to have a quick break now, and we'll return back to the stage at 3 p.m. If every